Nerves of the posterior compartment of thigh and gluteal region include the sciatic nerve, superior gluteal, inferior gluteal nerves, nerve to quadratus femoris, pudendal nerve, nerve to obturator internus, and posterior cutaneous nerve of thigh. Some of these nerves we covered in our previous lectures. Today we shall be covering sciatic nerve, nerve to quadratus femoris, pudendal, and nerve to obturator internus. So let's take a look on sciatic nerve. It is body's most thickest nerve, comprising of two components, tibial nerve and common peroneal nerve, wrapped up in a fascial sheath. Sciatic nerve is a branch of sacral plexus having root value L4, 5, S1, S2, S3. And it is formed by both the anterior and posterior divisions of the sacral plexus. Course of the sciatic nerve is that it exits the pelvic cavity through the greater sciatic foramen just below the piriformis. Here in the diagram you can see this is the piriformis muscle, the landmark in the gluteal region, and below it is arising the body's thickest nerve, which is called sciatic. Sciatic nerve, after entering the gluteal region, is the lateral most structure among the structures that are coming out through the greater sciatic foramen. So the structures that are located medial to sciatic nerve include the inferior gluteal nerve and vessels, internal pudendal nerve and vessels. So sciatic nerve continues to run down infrolaterally under the cover of gluteus maximus, midway between the ischial tuberosity and greater trochanter, so that during its course it lies on the ischial spine. Then further it continues to pass posterior to obturator internus. Here we have in this diagram the superior gemellus, obturator internus, and inferior gemellus, and here we have the quadratus femoris. So it is continuing posterior to all these muscles. Or in other words, these muscles lie anterior to sciatic nerve. So in the thigh, it enters under the long head of the biceps femoris muscle. And it lies in the thigh between the long head of the biceps femoris. This is biceps femoris, which is the lateral muscle in the posterior compartment of the thigh. So in the thigh, sciatic nerve lies between the biceps femoris, long head, and adductor magnus. At the back of the knee, there is a fossa, very important regional landmark called popliteal fossa, at the apex of which the sciatic nerve divides into its terminal branches, the tibial nerve and the lateral division of the sciatic nerve, which is called common fibular as well as common peroneal nerve. So this was all about the origin, course, relations, and branches of the sciatic nerve. Sciatic nerve does not give off any branches in the gluteal region. It is actually the main nerve supply of the posterior compartment and muscles of the leg of thigh and muscles posterior compartment of the thigh and muscles of the leg and foot. Clinicals of the sciatic nerve include a very famous clinical, which is called piriformis syndrome. Also, sciatic nerve often gets injured, especially in cases of misplaced intragluteal muscular injections. And then we have a condition called sciatica. So we will describe each one of them in detail. Piriformis syndrome is a syndrome that involves entrapment of the sciatic nerve, especially its common peroneal component, because common peroneal nerve, which is also called common fibular nerve, lies superficial to tibial nerve. when both of these components are entrapped or are wrapped up by the facial sheath. Piriformis syndrome is commonly observed in sports people and females. Secondly, in 12% of the population, common fibular nerve actually passes through the muscle instead of passing below it. Common peroneal nerve passes through the muscle. Hence, it is prone to entrapment. So in the piriformis syndrome, if the muscle, because of excessive use by the sports persons, it gets swollen up, that will lead to the compression on the sciatic nerve, which is, one of the components that is prone to the compression is the common peroneal nerve because of its superficial position in the facial sheath. As well as 12% of the population have their common peroneal nerves passing through the piriformis muscle. So excessive use of piriformis will lead to the hypertrophy of the muscle, leading to the entrapment and compression of the sciatic nerve, particularly the common fibular component. So the patient will experience pain in the which will start in the central region of the buttock, will continue to run down in the midline, in the posterior aspect of the thigh, up till the popliteal fossa, where the pain will be distributed along the lateral side of the leg, up till the little toe in the foot. So these are the signs and symptoms of the piriformis syndrome. Next, we have injuries to the sciatic nerve. Injuries to the sciatic nerve may result into the complete cutting off of the nerve or incomplete damage to the sciatic nerve. And such damage is more common with misplaced intramuscular injections in the gluteal region. And in those cases as well, common peroneal nerve gets injured more commonly because of its superficial position. As a result of damage to sciatic nerve, there will be motor loss as well as sensory loss. Motor loss will include the paralysis of hamstrings, but knee flexion will still be possible, though weak, but still be possible because of the actions of gracilis muscle, which is supplied by obturator nerve, and sartorius, which is supplied by the femoral. Whereas all of the muscles below the knee region, that is of the leg and foot, they will be completely paralyzed with no compensation, leading to foot drop. So sciatica nerve manifests in foot drop. You remember that in the upper limb, radial nerve, damage to radial nerve leads to wrist drop. And in the lower limbs, damage to sciatic nerve leads to foot drop. So in this aspect, both the nerves are comparable. Sensory loss. Sciatic nerve, as a result of damage to sciatic nerve, patient will feel no sensations below the region of the knee, except a long strip over the medial aspect of the leg as far as the tip of the big toe, which is the area supplied by the saphenous nerve, which is a branch of femoral. Next condition, which is commonly associated with the sciatic nerve is called sciatica. So sciatica is basically defined as pain that is felt along the sensory distribution of the sciatic nerve. Causes of the sciatica often include prolapsed intervertebral disc involving one or more than one roots, leading to the compression of the sciatic nerve. And patient experiences pain again starting from the center of the buttock region, going down into the midline of the back of the thigh up till the apex of the popliteal fossa, where the pain then gets distributed more commonly along the area of distribution by the common peroneal nerve. So this was all about sciatic nerve, its origin, course, branches, termination, and planing. Nerve to quadratus femoris. It is again a branch of sacral plexus. Here in this diagram on the right side, you can see the nerve to quadratus femoris. It exits the pelvic cavity through the greater sciatic foramen. It runs down anteriorly or deep to sciatic nerve, passing the root of ischial spine, reaches the superior gemellus, obturator internus, and inferior gemellus, continues to run till the quadratus femoris, and it ends by giving off muscular branches to inferior gemellus and quadratus femoris. Next, we have pudendal nerve and nerve to obturator internus. Both of these nerves arise from the sacral plexus. Both of these nerves together exit the pelvic cavity via greater sciatic foramen below the piriformis. Both cross the ischial spine along with their respective vessels, especially the pudendal nerve along with its internal pudendal vessels. And both of these nerves, they leave the gluteal region by re-entering the pelvis via lower or lesser sciatic foramen. Their pudendal nerve comes to lie within the ischiorectal fossa, which you will study with abdomen pelvis in second year MBBS. And pudendal nerve ends by distributing into the perineum, whereas nerve to obturator internus ends by supplying the pelvic surface of the obturator internus muscle. So here in this diagram, you can see the pudendal nerve, and here you can see the obturator internus. You can see the relation of these two structures with each other. Internal pudendal artery basically lies between the two nerves, pudendal nerve and nerve to obturator internus. So this was all about the different nerves present and supplying the gluteal regions as well as posterior compartment of the thigh. So now let's see a few MCQs related with the nerves and vessels of the gluteal and posterior compartment of thigh. All of the following nerves are related with ischial spine except. So now in this question is not a straightforward question. You are required to pick up the false option that is most relatable with the stem of the question. So in this question, you are supposed to pick up one nerve that does not lie in close relation with the ischial spine. So that means that you have to pick at least 4 of the 5 nerves which lie in close relation with the ischial spine, and for that you must know the course and different relations of the different nerves passing in the gluteal region and posterior compartment of thigh. So we have sciatic nerve, nerve to quadratus femoris, pudendal nerve, nerve to obturator internus, and inferior gluteal nerve. So now you have to pick up the 4 options that lie in close relation with the ischial spine. In that case, you will land on the correct option. Next question reads, which of the following nerves has no branches in the gluteal region? So again, you must remember the nerves that are not only present in the gluteal region, but they also give off branches to the structures in the gluteal region. And then again, we have some nerves that only pass through the gluteal region, but they do not actually supply or they do not give off any branches to the structures present in the gluteal region. So in this question, you have to pick such nerve that only passes through the gluteal region without giving off any branches to its structures. So in the options, we have superior gluteal nerve, inferior gluteal nerve, nerve to quadratus femoris, and nerve to obturator internus. Students often confuse 2 things when it comes to such questions. They confuse the course of the nerve with their area of supply. So they naturally think that if some particular nerve is passing through one region, it will also give up branches to the structures present within that region, which is not always true. So do not confuse such points related with the course of a nerve. Next question is, which of the following structures gets compressed in piriformis syndrome? Now you have to identify the structures which are more prone to be compressed in case of piriformis syndrome. So we have tibial nerve, common fibular nerve, inferior gluteal nerve, inferior gluteal artery, and posterior cutaneous nerve of thigh. So you will see such questions, they are often confused by the students because they think that all of the options are correct. So which option is going to be most likely the right option or right answer for this particular question? Because according to those students, all of these options seem to be correct, but no. It is true that all of these structures lie in close relation to piriformis muscle. But then again, only one structure is going to get compressed in the piriformis syndrome. And there is a reason for that, which we just discussed in our previous lecture. So such questions often confuse students because they think that all the options are correct. But in reality, not all the options are correct. So you have to pick the most likely relatable answer to the asked question. So good luck with solving these MCQs.